Welcome to the presentation on duloxetine. Duloxetine is used to treat various conditions such as depression, anxiety, fibromyalgia, and pain, which belongs to a class of medications known as selective serotonin and norepinephrine reuptake inhibitors, SSNRIs. This active ingredient helps to increase the levels of certain neurotransmitters in the brain, which resulting in increased feelings of well-being and reducing the symptoms of anxiety and depression. The gastro-resistant coating enables the active ingredient to reach the small intestine. This provides adequate serum levels of duloxetine to achieve the desired therapeutic effects. The recommended starting dose for Duloxetine Gastro-resistant tablet IP 20 mg is 60 mg once daily. However, the dose may increase or decrease depending on individual response. Regular monitoring of side effects and reduction or increase in dose may be recommended by the healthcare provider. Common side effects of this medication may include nausea, vomiting, diarrhea, constipation, difficulty sleeping, and headache. It should be stored away where children and pets cannot reach and should not be shared with others. Patients should follow the dosage and usage instructions from their doctor, and it is important to adhere to this exact dosage. Duloxetine Gastro-resistant tablets IP 20 mg may improve mental well-being and reduce symptoms of depression and anxiety. It is important to take this medication as prescribed by the doctor.